Do you frequently feel like your heart pains sometimes? Or maybe you've noticed that even a small cut takes forever to stop bleeding. What if I told you it might not just be bad luck, but a rare problem with your blood? Meet Bernard-Soulier syndrome, a rare bleeding disorder where your blood doesn't clot the way it should. Imagine you scrape your knee while playing football. Most people stop bleeding in minutes, but for someone with this condition, the bleeding could go on for hours. Why? Because their platelets, the tiny cell pieces that act like emergency responders to plug wounds, are either too few or don't work properly. It's like having a fire station with trucks, but the trucks can't stick to the fire. So what causes this tricky problem? Bernard-Soulier syndrome is something people are born with. It's genetic. Think of your body like a big factory, run by instructions in your DNA. In this case, the factory workers, your genes, got a faulty manual. The mistake is usually in one of 4 key genes: GP1BA, GP1BB, GP9, or GP5. These genes are in charge of making special proteins on the surface of platelets. These proteins are like hands that help platelets grab onto the damaged blood vessel walls. Without these hands, the platelets float by like bystanders who see an accident but can't do anything to help. And because this is inherited, if both parents carry the faulty gene, there's a 25% chance their child will get the syndrome. So, family history matters a lot here. Now, how do you know if someone might have Bernard-Soulier syndrome? Let's play detective. Have you ever had a nosebleed that lasted more than 10 minutes, even when you pinched your nose and stayed calm? Or maybe you noticed lots of small red or purple spots on your skin, like tiny bruises, with no memory of bumping into anything. These are called petechiae, and they're a hint. Women might struggle with very heavy periods. Babies might bleed a lot from the umbilical cord stump after birth. Kids might bleed longer than normal after losing a tooth. In short, any situation that involves bleeding, even slightly, becomes a big deal. Platelets are not doing their job, so the body can't form a proper clot. It's like trying to build a sandcastle with wet sand that just won't stick together. How do doctors figure this out? First, they ask about your bleeding history, like a story of every time you bled more than expected. Then, they take a blood sample. Under the microscope, the platelets in Bernard-Soulier syndrome are unusually large, like giant platelets, which is a big clue. Special tests check how well platelets clump together in this disease. They don't clump when exposed to ristostin, a substance used in labs. This test is like a handshake test. Do the platelets shake hands with the damaged wall or not? For treatment, there's no cure, but doctors help control bleeding. During injuries or surgeries, patients might get platelet transfusions, like borrowing working platelets from donors. Fibrin glue, a medical superglue, can be applied to wounds. Avoiding drugs like aspirin that worsen bleeding is also key. So treatment is like a smart backup plan for your body's broken repair system. Can we prevent Bernard-Soulier syndrome? Well, since it's genetic, you can't prevent being born with it. But you can prevent dangerous complications. Think of it like living with a known allergy. You learn to avoid triggers. For this syndrome, prevention means avoiding activities with high injury risk, like full-contact sports. Always inform doctors or dentists before procedures. Use soft toothbrushes to prevent gum bleeding. Genetic counseling is also important. If you or a partner have a family history, talking to a genetic counselor is like checking the blueprint of your future children before building the house. You can't change the genes, but you can prepare and protect. What's new in science? Researchers aren't giving up. One exciting area is gene therapy. Imagine fixing the faulty gene in a patient's own cells and putting them back. Early lab studies show promise, though it's still experiment. Scientists are also working on artificial platelets or drugs that help existing platelets work better, like giving the bystander platelet workers a tool to help plug the leak. Clinical trials are slowly moving forward. While it's not available yet, These advances offer hope. Think of it like upgrading software. One day, instead of borrowing platelets, the body might run on a corrected version of its own code. The future is not here yet, but it's being built.